Good evening. Thank you for joining us for News 4 at 10. I'm Steve Savard.
And I'm Samantha Jones, working from home this evening. We start with brand new information showing the coronavirus pandemic is far from over. It is a grim milestone. The world now sits at more than 3 million cases tonight, and some 211,000 people have died of COVID-19. The U.S. remains the worst. We are close to 1 million cases. All new tonight, JetBlue becoming the first U.S. airline to require you wear a face mask. That order will kick in May 4th. JetBlue is already requiring all crew members to cover their faces. And right now, the final moves are being made to reopen the state of Missouri. Governor Mike Parson detailing his plan, which he says is being coordinated with the White House. That all kicks in 1 week from tonight. Steve.
Sam, despite the reopening plans, coronavirus cases continue to be on the rise in Missouri. We have team coverage of the do's and don'ts, and we're even hearing from those who say not yet, it's too soon. We begin with Alexis Zotos, who's been drilling down on the governor's orders.
We are ready to take another step forward in the recovery of Missouri. As I have said, this will be the turning of a dial, not the flip of a switch.
Restaurants, salons, churches, and gyms will all be allowed to reopen on Monday, May 4th, but not without restrictions.
All businesses can open under this order as long as the guidelines are followed.
Here are some of those guidelines. Social distancing must remain in effect, keeping 6 feet apart. Restaurants can fully reopen, but there are dining room limits. Retail must limit the number of shoppers based on square footage. Employees do not count towards occupancy limits. And according to the governor's order, the social distancing requirements do not apply to individuals performing job duties that require contact with other people closer than 6 feet, like dentists and hairstylists. While the governor has issued these new guidelines on how to reopen the state of Missouri, he does say that cities and counties can still maintain stricter requirements like the city of St. Louis and St. Louis County.
Some communities may be able to reopen at a faster rate, while others may need to continue some guidance to keep their virus from spreading.
55% of Missouri's known coronavirus cases are in the St. Louis area. 65% of all of the deaths are in St. Louis City and County. The task force believes the St. Louis region hit the peak this past weekend.
According to the president's reopening plan, they are asking for a downward trajectory of 14 days. We haven't seen that here in Missouri. So why are we reopening 1 week from today?
Yeah, I think we are seeing that. I think we are seeing that. I think we're going to be able to have the data to show that 14-day downward spiral.
A look at the Missouri State Health Department's graph shows a downward trend since April 7th, but not a steady decline. So today, the governor said 71,000 people have been tested in the state of Missouri for the coronavirus. That is 1% roughly of the state's population. In St. Louis County, the health department director said she would like to see 2,000 people tested per day before lifting that stay-at-home order. The state tells us that they are working with the local health departments on more testing. Reporting live, Alexis Zotos, News 4.
All new at 10, the St. Louis Metropolitan Clergy Coalition is urging metro churches not to reopen next week. Coalition leaders say they do not want to put people in harm's way, noting that the virus has taken an especially heavy toll on the African American community. We should learn more about what the clergy is proposing tomorrow. Sam?
Now we shift to those, Steve, who are not and who are planning to reopen come Monday. News 4's Emma Hogue is in St. Charles tonight. Emma, some businesses won't reopen as soon as next week.
Right, Sam. Tonight, some businesses like Salt and Smoke tell me they are just not ready to reopen. Take a look at all of this patio furniture. The owner tells me when he does reopen, they likely will only be able to seat half of their current capacity. As of now, St. Charles County says it plans to follow the governor's orders instead of enforcing stricter guidelines of its own.
Well, I think everybody's really excited to figure out how to get back to normal.
After weeks of offering curbside carryout, Governor Mike Parson is giving restaurants the green light to open Monday. Residents in St. Charles County have mixed opinions.
That's very exciting because this has been very hard on a lot of people.
I realize there are a lot of people that want to get out there, but I'd rather be safe than sorry.
Opening these businesses is going to look very different for a while.
Restaurants are still required to follow social distancing guidelines, meaning tables must be spaced out with no more than 10 people at a table. He's encouraging employees to wear PPE and use disposable menus.
We're excited that it's an opportunity.
But tonight, some owners like Tom Schmidt are pumping the brakes. The owner of Salt and Smoke says he's not ready to open his St. Charles location on May 4th.
It's kind of hard to solve the problem when you have a dining room full of people. So we don't want to kind of get caught unaware. We want to make sure that what we're doing has been proven and tested.
So what could the new era of dining look like? Schmidt says he's adding air filtration systems and bacteria-killing UV lights. Employees at Salt and Smoke will likely wear masks and gloves, and capacity will be cut in half at most.
Bringing back another 150 people to work also takes more than just a handful of days to be able to pull that off. So there's a lot of things to consider and how to do this and how to do this right.
Tonight, News 4 reaching out to other metro counties to find out what they're doing. Franklin County reopened Saturday, so there's not much change. But in Warren, Jefferson, and Lincoln counties, leaders say as of now, they plan on following the governor's guidelines instead of enforcing stricter measures of their own.
I think part of that is figuring out how to do that in a safe way.
So this is something we're hearing from a lot of business owners. Yes, they're excited about the opportunity to reopen, but they're still working on their game plans on how to do that safely. Here at Salt and Smoke, the owner tells me he still has no idea when his reopening date will be. We're live in St. Charles County tonight. Emma Hogue, News 4.
Tonight, the Illinois statewide stay-at-home order is getting pushed back in the courts. A Clay County judge is blocking the extension of the order through the end of May. State Rep Darren Bailey was granted a restraining order against Governor J.B. Pritzker's extension. The lawsuit applies only to State Representative Bailey, making him exempt from the order now. It's unclear what impact the legal challenge could have on other Illinois residents. Governor Pritzker's office says it will appeal the decision. We have new coronavirus symptoms to tell you about. These are coming straight from the Centers for Disease Control and Prevention. There are 6 to make note of. Chills, repeated shaking with chills, muscle pain, headache, sore throat, and loss of taste or smell. Health experts say those symptoms could appear anywhere between 2 and 14 days after being exposed. We have the complete list of possible symptoms on the KMOV News app.
Scientists around the world are racing to develop a coronavirus vaccine, and new tonight, we're learning some may have an early lead. Scientists at Oxford University already scheduled testing of more than 6,000 people by the end of next month. The researchers say if approved, the vaccine could be ready by September. That would likely require an emergency approval from regulators. Some scientists are trying to find methods to treat the virus, while others work to ensure people don't get sick in the first place. News 4 investigator Lauren Traeger now with the scientists at one company on the cutting edge of a treatment.
It's not a matter of if, but when.
It's almost as if Netflix had a crystal ball. A documentary released in January laying out how devastating a disease could be around the globe.
We're making a vaccine that could treat all future versions of flu.
Featured prominently a company called Distributed Bio on the West Coast, a company with a lofty goal.
A future population that isn't susceptible to diseases like this anymore.
Sharad Durakia is senior scientist.
You guys were sort of thinking about something like this long before we all were.
Sure, yeah. Our CEO, Jake, was at a BioThreats meeting in DC late January, and I think this is when the coronavirus was really starting to hit stateside. So shortly after he got out of the meeting, he gave me a call and said, I think this is something we really need to work on.
Instead of a universal flu vaccine, they threw every effort at curing the coronavirus.
We've moved at a tremendously fast rate, faster than we usually would in other antibody engineering or therapeutic programs that we have at our company.
Their idea, antibodies.
Whenever you get a viral infection, you have antibodies that either recognize that virus and they come and they kind of signal your immune system to attack it and destroy it. In the case of coronavirus, we don't have those natural occurring antibodies yet.
Other researchers like those at the Mayo Clinic have started studying antibodies from recovered coronavirus patients. Some people now being treated with recovered patients' plasma. But Distributed Bio is doing it a little differently, converting antibodies from the previous SARS virus.
Instead of waiting for the human to develop their own antibodies, their own protection against COVID-19, we've gone ahead and started engineering those antibodies in our lab to kind of beat that timeline that it takes for the body to develop its own.
The possible result, treatment for people who are already sick and prevention for those who aren't yet.
If it can block this interaction, that means we got antibodies that work in kind of blocking this cascade of the virus when it enters the immune system.
They're hoping to start trials soon on hamsters, then humans. Time of the essence.
Is that top of mind for you?
Absolutely. In terms of getting it out even faster, we have to stick with the FDA guidelines and make sure that these antibodies are at the end of the day safe for human consumption and won't have any weird or alternative effects within the human system.
Like other treatments, testing and development will take time and resources.
We are doing our best to raise some money and crowdfund in order to move into human trials.
But the work important to save lives and move forward.
So we can go back to our normal lives of being able to go outside and see family and friends once again.
The military is now helping Distributed Bio with some of their testing. They don't think the product will be available until maybe August, which seems like a long time away, but they say that's really an expedited timeline for something like this. They're hoping to roll the product out first to the really sick, the elderly, and to medical professionals before it would be available to everyone. We will certainly keep tracking their progress. I'm Lauren Traeger, News 4 Investigates.
New tonight, the second round of small business loans are off to a troubling start. Technical glitches are plaguing the rollout of the new funding. All day, business owners applying for the Paycheck Protection Program have been reporting error messages and slow processing. Should be noted, problems were also reported when the first round was first made available April 3rd. That $349 billion ran out in 13 days. This new infusion of funding includes $321 billion.